There are a lot of folks that live in Dare County that can't afford health insurance and don't have a way to get health care. But these are the same people that work very hard and have families to support as well. And they contribute very well to the community, just as we all do. And I think we need to support those people and those families just the same.
It's just a good thing. It's something I feel really good about. It's the patients are so grateful that we're here, and so it's just a rewarding thing to me.
I'm from here. I've lived here my whole life. I know the types of jobs, people fish, people build, people work at restaurants, and there are no benefits. It's honest work. But you're not going to have Blue Cross Blue Shield when you're doing that.
In this economy, it's critically important because people have out of work. They need to make choices about what their limited funds can afford, and oftentimes health care is not the priority. It's unaffordable, and people are focusing on food, paying their electric bill, paying their rent. But any one of us could be in the position of needing this sort of health care, so it's about neighbors helping neighbors.
Our patient population here at the community care clinic are basically those that can't afford health care, medical insurance.
The typical patient that we see here at the clinic are patients that have some chronic health problems such as hypertension, dyslipidemia, diabetes. We see a lot of diabetic patients here.
We basically see patients that are uninsured and assist them with registrations and care, basic care that's needed in our community.
We operate on a no fee of any kind basis. In this area, there's a lot of under or uninsured individuals. I'm from here. I've lived here my whole life. I know the types of jobs, people fish, people build, people work at restaurants, and there are no benefits. It's honest work. But you're not going to have Blue Cross Blue Shield when you're doing that. So we fill that gap and provide medications and health care that a lot of times they're just not getting any if there's not someone like us here.
We provide basic health care for our patients. We are the end of the line for most of them. If they are not seeing us, most likely they're getting no health care whatsoever. We're the gap fillers.
There was a health assessment done in the county, and it brought forward a number of issues that existed in the county, one of which was the large number of uninsured or underinsured people, which translates to people that have no access to health care.
There are so many holes in our safety net right now for folks to be able to get medical care. That it's an awfully important service. We just don't have a way to take care of everybody in our population. There's a lot of people winding up in the ERs that ends up being an awfully expensive way to get care and an awfully late way to get care after problems are too advanced.
We have one clinic located in Nags Head, and we have one located in Frisco.
Our clinic is open 2 days a week, Mondays and Wednesdays from 9 to 2, and when there's just one provider here, we probably see somewhere between 15 and 18 patients. If we have 2 providers available, those days we'll see double that. We also have a night clinic 2 Mondays a month from 6 to 9, and we have several doctors in the community that volunteer their time to come in and be available for night clinics. So for patients that can't get here during the day, we do have that availability as well.
We provide basic health care for our patients. We help them in the solicitation of any specialty care if possible, but as a rule we're their basic health care providers.
We help patients to get any kind of prescription medications that they might need through various prescription program assistance things that we have.
Through the free clinic, we are trying to provide somewhat of a medical home for people that might not have it, so that they can manage their illnesses before they get too severe and they become an emergency and they're going to the emergency department for care.
If a patient is for some reason unable to afford a prescription that the doctor gives to them, they can bring their prescription into us, and there are various programs that we can use their financial information to plug into the computer and see, based on eligibility requirements, what programs will be able to provide their medications for them.
So if there's a medical problem that you feel you have, if you're not sure that you qualify for services, please give a call, because this clinic is for anyone in need of our services to help people maintain health, promote health, and manage chronic diseases that can affect one's quality of life.
How can I help the clinic? The first answer I would give, the first part of the answer would be learn more about the clinic. Learn more about why it exists and who it serves.
Come talk to us. Volunteer. If you have no medical training, that's fine. We need people for data entry. We need people answering phones.
You think that I have health care, my friends have health care, but it doesn't affect me.
You know somebody who is a patient here. You might not know they are.
If you have people that have chronic illness or have problems and they are out working in any number of places and you come in contact with them, you're exposed to that same thing.
I do a lot of volunteer work. You can feed them, you can do all kinds of things, but health care is really, really important. So people who could volunteer their time, their services, or donate in any way or have any kind of fundraising would be wonderful.
There's so many different needs. People with medical backgrounds can help directly in patient care, but then there's people helping out with food, so people can be here volunteering and not having to stop and get food, or with the paperwork that always has to be done in medical care.
A big thing that we're in need of right now is volunteers. So if anybody was able to donate their time to come in and help, I would say that would be the best way to provide assistance here right now.
Donating to the community care clinic is a way of giving back to your community, which I think is very important. When you donate to the community care clinic, the money stays in Dare County, it stays at the clinic. Oftentimes when you donate to a large non-profit organization, you don't really know where your money goes.
Any one of us could be in the position of needing this sort of health care, so it's about neighbors helping neighbors.
Somebody came to our job and told us about the clinic, and it seemed like a really good thing. There's a need in the area, and it's just a good thing. It's something I feel really good about. The patients are so grateful that we're here, and so it's just a rewarding thing to me.
I belong here. I've only been here a month. The people are wonderful. The job that the clinic does for people on the outside is just fantastic, and it is an honor to be a part of that.
I think people should volunteer because this is a great way to give back to the community and help our fellow community members. It
would be wonderful if we had financial assistance, and it would be wonderful if they would volunteer. But in addition to that check that they write, or that hour or 2 or 5 that they spend here, if they are conversant about the clinic, understand the problem and what the clinic is designed to address, at that point they will have the opportunity to speak to other people, and as more people understand, they too can volunteer or contribute, or they could be more proactive in their efforts talking to elected representatives.
On my very first day working for the clinic, my office was set up such that I could hear conversations at the front desk, and I overheard a conversation where one of our patients was checking out, and in doing so she said, "I thank God for y'all every day." To me that says it all.